This is Obesity in the Hispanic Community by Andrea Thomas and Jessica Toy for the University of North Carolina at Wilmington, Spanish 120 OAP, Fundamentals of Spanish. Vocabulario for this slideshow is weight, peso, overweight, sobrepeso, obesity, obesidad, diabetes mellitus, diabetes mellitus, hypertension, hipertensión, calories, calorías, heart attack, ataque al corazón, stroke, accidente cerebrovascular, hypercholesterolemia, hipercolesterolemia, portion control, control de porciones. The picture on the left shows the Hispanic population within the United States. Obesity is an epidemic here, and according to the CDC's most recent data, approximately 3 in 4 adults in the United States is considered overweight or obese with a BMI equal to or more than 25. For the Hispanic community, that number is even higher at 82%. That's 79% of women and 85% of men that are overweight or obese. And 26% of Hispanic children ages 2 to 19 are obese. While the percentages are shrinking over the years for Americans in general and Hispanic men and women, this number for Hispanic children is actually growing. The effects of obesity. These risks are, of course, applicable to all obese people. The difference here is that the Hispanic community is already at a higher risk for these conditions than their white counterparts. According to the CDC, 45% of Hispanic American adults have hypertension and about 29% have diabetes. According to AHA statistics, 52% of Hispanic men and 43% of Hispanic women have heart disease. 24% of Hispanic Americans have hypercholesterolemia. Hispanic Americans also have a higher than average risk for liver disease, and it is actually the 7th leading cause of death in Hispanics, while heart disease is the 2nd leading cause. Smoking, as we know, increases the risk of these conditions. The percentage of Hispanic men aged 18 and over who currently smoke cigarettes is 13%, and for women, it's 7%. The cultural importance of meals. It is important when we're looking at obesity in the Hispanic population to understand that for Hispanics, the overarching theme is that food equals passion, and it's involved in many aspects of life. Hispanic culture is rich and full of life and food. Eating together, a study found that in Hispanic families interviewed, mealtime consisted of the mother and children. Those mothers stated that the father usually worked late or would otherwise be present. In all cases, the families found certain meals or days of the week when they could eat together. The families also stated that meal times were a time to talk to one another. As a side note, the time spent talking around the table after a meal is referred to as sobremesa in Spain. Family gatherings are frequent and elaborate in Hispanic communities. Families get together for holidays and festivals, birthdays, after church, and even more. In a 2018 study, researchers found that the meaning of eating healthy foods varied between families and even between adults and children. They found that serving sizes of vegetables varied from an amount of the size of an apple a day to 3 or 4 servings a day. 3 out of 25 families interviewed spoke about the My Plate initiative, but only a single family recognized that half the plate should be fruit and vegetables. Families also talked about culture as a reason that they were unable to eat healthy foods. They listed frequent family gatherings as one of those reasons. Integrating exercise. According to the CDC, only 21% of Hispanics in America are exercising in their leisure time. It's important for our patients to hold on to their cultures. So, in educating your patients about integrating exercise, there are some great Hispanic customs that we can help them incorporate to get and stay healthy. The first is dance. Dancing is a huge aspect of Hispanic heritage, no matter the country of origin. and there are so many to choose from. For our Hispanic patients, dancing is an important part of gatherings and festivities, but with our help, we can make it part of a healthy routine, whether it be through classes or just turning on music at home to get in a great cardio exercise. Soccer or football is a passion for Latinos. All that's required to play is a ball, maybe something that resembles a couple of nets and a few friends, but soccer drills can be done alone. For our Spanish-speaking patients, there's a large variety of free workout videos and tutorials in Spanish on the internet, especially on YouTube. Today's world of hustle and bustle makes it hard for all of us to find time for a full gym routine. So teaching our patients how to integrate exercise into daily life is incredibly important now more than ever. Examples of this would be taking the stairs instead of an elevator or escalator, dancing or walking in place while cooking and cleaning. Simple exercises like calf raises that can be done even in line at grocery stores. Taking a walk during breaks at work, and including family in workouts or after-meal walks. We should also be making sure that we include benefits of exercise other than weight management. Ensure the patient that exercise can lower blood pressure, glucose, and cholesterol levels, and improve quality of sleep, focus, and mood.
Obesity rates in Hispanic children are anywhere from 2 to 4 times higher than non-Hispanic white children, with the differences being noted as early as kindergarten. Approximately 40% of Hispanic children in the U.S. are considered overweight or obese, with 20% of the Hispanic children in the U.S. being considered obese. Up to 25% of the Hispanic population in the United States is considered to be living below the poverty line. Many of these Hispanics are using food stamps as a source of providing food in their households. There is a possibility for a binge eating type of behavior to happen in these households where during the first 3 weeks after they receive their food stamp benefits, they can eat well. With the last week, they have a period of scarcity, which leads their body to retain the calories to go into like a hibernation mode and save the calories, leading to obesity. In these times, cheap, quick, fast food can be easy when working long hours also. But also frozen fruits and vegetables can be a great way to pack nutrient-dense foods while they're on food stamps. When working with the Hispanic population, they can be encouraged to eat the same foods they love, but make different choices to improve the nutritional value of their foods. Try including different colors of peppers, using brown rice, maize, yuca, yams, plantains, swapping out for whole wheat or corn tortillas, looking for different kinds of lean proteins, the skinless chicken breast, different beans, grilling fish, and eating more avocado, although not too much, and less full-fat cheese with their meals. For some, it's just a matter of education. It's incredibly important to find out what their, an individual's baseline understanding is of nutrition labels and what my plate is, and what that means for their nutritional choices and portion sizes to help them make better choices, especially with simple things, just looking at added sugars, making sure they're not eating too many grains or fats, making sure they're getting enough vegetables and proteins, or even knowing what would be considered overweight or obese. One thing we do strive to work towards in this country, hopefully, is getting our Hispanic population to seek more preventative care, primary care, having more access. Even in California, they've passed a law where even undocumented citizens have access to purchasing plans through the Affordable Care Act. Not everywhere, but it is in California, so hopefully we can move towards that in other areas. But the Hispanic population can be hesitant to seek preventative care due to a lack of cultural sensitivity, just getting to the doctor because of the region they're in, not having enough Hispanic healthcare providers, or again, being undocumented. Having more Spanish-speaking healthcare providers have been shown to improve those outcomes. And I can only imagine that would make sense for any of us if we were in a different country going to an either American or English-speaking provider. It would make us more likely to be compliant with doctor's orders or recommendations, and just feeling more comfortable all around. Thank you very much.